Hi, this is the continuation of our series of videos designed to give individuals information that they can use to prepare for a visit to a physician. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care will be obtained. Measles is the subject of this video. So far this year, a high number of measles diagnoses have been made in certain parts of the United States. From January 1st to August 1st, 2019, 1,172 individual cases of measles have been confirmed in 30 states. This is the greatest number of cases reported in the U.S. since 1992, and since measles was declared eliminated in 2000. Measles is a highly contagious disease that was made an uncommon disease, eliminated, with the use of childhood vaccinations. But not all people in other countries have been vaccinated, and with increases in worldwide mobility, the risk of exposure exists. And still, a certain segment of the adult population feels it is their right to keep childhood vaccinations from their children. The reasons they may feel this way will not be discussed here. Our objective is to help you identify whether or not an acute rash in a child or an adult should be considered as measles. Early diagnosis is important because exposure to measles means there is a high probability that it will be transmitted to those exposed who have not been vaccinated, or those individuals, approximately 3 out of 100, who received the vaccination but did not obtain appropriate immunity. Transmission is usually by droplets expelled from the mouth and nose when an infected individual coughs or sneezes. It will usually take 1 to 2 weeks before an infected individual begins to show signs of infection. The individual is infectious for 5 to 7 days. The person is most infectious just before the measles rash appears. Initially, during the first 3 to 4 days, the individual will have a runny nose, red watery eyes, and a cough. The mucosa of the mouth will also have tiny white spots called Koplik spots. Then a blotchy red rash that tends to run together appears. Again, the rash may last for 4 to 5 days. The rash typically begins behind the ears and spreads to the face. Then it spreads to the trunk and limbs. The rash blanches with pressure, which means that the redness is lost when pressure is applied, but returns when pressure is removed from the rash. As the rash fades, there may be temporary residual skin discoloration, but this will also fade. The cough may linger for a few days more. Treatment is supportive: bed rest, hydration, and reduction of fever. Now, there can be complications. Secondary bacterial infections can develop and produce pneumonia, middle ear infections, and sinus infections. Encephalitis may also occur. Although rare, it can occur. Encephalitis is an inflammation of the brain. Febrile seizures can also be a complication. A febrile seizure is a convulsion in a child caused by a spike in body temperature, usually greater than 100.4 degrees Fahrenheit, which is often caused by an infection. It can be frightening when your child has a febrile seizure, and the few minutes it lasts can seem like an eternity. But they are usually harmless. Prevention should be the goal. There is no need to expose a child to measles and possible complications when a vaccine is available. Children should get 2 doses of the MMR vaccine. This is the measles, mumps, and rubella vaccine. The first dose is usually at 12 through 15 months of age. The second dose is at 4 through 6 years of age. Now, infants who may be traveling outside the United States when they are between 6 to 11 months of age should also get a dose of MMR vaccine before traveling. This can provide temporary protection from measles infections, but will not give permanent immunity. The child should still get 2 doses at the recommended ages for long-lasting protection. Adults might also need MMR vaccine. Many adults 18 years of age and older might be susceptible to measles, mumps, and rubella without knowing it. There are no known risks to getting measles, mumps, and rubella vaccine at the same time as other vaccines. Now, in future videos, we will continue to discuss acute rashes, particularly mumps and rubella, that appear in children and adults. I hope this helps. Have a good day.